discuss about breastfeeding and what is its significance, what are the composition, then secretions of anatomy and physiology, how does it get secreted, what are the types and composition of the human breast milk, nutrients in the human and the difference between human and animal milk, and health benefits of breastfeeding, what are the rules of breastfeeding, storage of breast milk and barriers to breastfeeding, contraindications of breastfeeding and risks of breastfeeding. So let's go one by one. According to the WHO and American Academy of Pediatrics, breastfeeding is the normal way of providing young infants with the nutrients they need for healthy growth and development. Breastfeeding helps defend against infections, prevent allergies, and protects against a number of chronic conditions. Excuse me. Coming to the anatomy and physiology, the breast consists of a glandular tissue and supporting tissue and fat. Milk is secreted by the glands and travels through the tubules which drain into lactiferous sinuses. The sinuses, which store small quantities of milk, lie below the areola. They open out onto the nipple through laciferous ducts. The thin layer of the muscle, that is myoepithelium, surrounds each gland. The contraction of these muscles causes ejection of milk from the glands. There are ducts from the nipple, lactiferous sinuses, then the ducts, then the alveoli, and supporting tissue and fat. So that's secreted through alveoli to the ducts and the lactiferous sinus, and it's secreted through the nipple. Milk production and secretion. Milk is produced as a result of interaction between the hormones and reflexes. During pregnancy, the glandular tissue is stimulated to produce milk due to various hormonal influences. There are two reflexes mediated by two different hormones come into play during lactation. Prolactin is produced. What is prolactin reflex? Prolactin is produced by the anterior pituitary gland, which is responsible for the milk secretion by the mammary gland cells. When the baby sucks, the nerve endings in the nipple carry messages to the anterior pituitary, which in turn releases prolactin. The earlier the baby is put on the breast, the sooner the reflex is initiated. That is why we always suggest within half an hour of the normal delivery, the breastfeeding has to be initiated. Within 1 to 2 hours of the cesarean, so breastfeeding has to be initiated. The more the baby sucks at the breast, the greater is the stimulus for milk production. The greater is the demand for milk, larger is the volume of the milk is produced. What is prolactin milk secretion reflex? The baby starts suckling. As we already discussed, there is a sensory impulses from the nipple and prolactin is released, and that enhances. The enhancing factors would be suckling, expression of the milk, and emptying of the breast, and the night feeds. What are the hindering factors for the breast milk secretion? That is the incorrect position, painful breast, and prelacteal feeds, and the tough feeding. So these are the hindering factors which should be kept in mind. What is oxytocin reflex? Oxytocin is a hormone produced by the posterior pituitary. It is responsible for the contraction of the myoepithelium around the glands, leading to ejection of the milk from the glands into the lacteal sinuses and the lacteal ducts. This hormone is produced in response to stimulation to the nerve endings in the nipple by sucking as well as by thought. Even a sight or sound of the baby can also be reflexively be initiated. The other hindering factors is for the breast milk ejection is the worry, stress, pain, and even in doubt. The enhancing factors would be think lovingly about the baby, the sound, sight, and even mother is relaxed when she is comfortable, confident of herself, then the milk gets secreted. So this has to be uh, create an awareness, not during the postnatal period. This has to be briefed to her in the antenatal period. So the breastfeeding, enhancing the breastfeeding is not only a role of the neonatologist or the pediatrician, it is the obstetricians right from the intrauterine. Pituitary releases prolactin and oxytocin. That hormones travel via bloodstream, mammary gland, stimulate milk production. That is a milk ejection reflex or a let down reflex. The infant suckles at the breast with the stimulation of the nerve findings in the mother's nipple or areola sends a signal to the mother hypothalamus bar pituitary that will release the prolactin and oxytocin. The types and composition of the human breast milk. The types are that is the early milk are also called as colostrum, transitional milk and the mature milk. What is colostrum or the early milk? It is produced in the late stage of the pregnancy till 4 days after a delivery and is rich in antibodies. So usually the Indian scenario, grandmothers generally discard this thinking that it is of no use. So that has to be highlighted. It has got a rich in antibodies. So this traditional practice has to be discarded. Transitional milk produced from day 4 to day 10 is lower in protein in comparison to colostrum. Whereas a mature milk is produced from approximately 10 days after delivery up to until the termination of the breastfeeding. So when you compare the composition of the each as the colostrum, transitive and the mature milk, the protein is maximum in colostrum and the fat is more with the mature milk, and carbohydrate is also more with the mature milk. The calories is the colostrum is 150 kilocalories in 100 ml, whereas mature milk is 65 to 70 kilocalories in 100 ml of a milk. So the advantages of colostrum has to be enhanced or briefed to the patients and the patient's attendants who is taking care of the mother. Milk which is outpoured in one feeding can be classified as foremilk, that is early milk at the beginning of the feeding got more lactose, proteins and water and satisfies the baby's thirst. What is hind milk or the late milk, which comes later towards the end of the feed and is richer in fat content and provides more energy and satisfies the baby's hunger. For optimum growth of the baby needs both fore and hind milk. The baby should therefore be allowed to empty one breast and second breast should be offered after emptying the first completely, so that hind and fore milk is given and the baby is satisfied. What are the advantages of a breastfed baby? There are more good things the baby needs. Coming to antibodies, hormones, antivirus, anti-allergic factor, anti-parasite, growth factor, enzymes, minerals, vitamins, fat, DHA, carbohydrates, protein, and the water. And coming to the formula feed, all these minerals, vitamins, fat, carbohydrates, protein, water is there. But the previous said factor like antibodies, hormones, anti-allergic, anti-parasite, growth factors are lacking in a formulated feed. Then bacterial contaminants are none. It is absolutely sterile. Whereas animal milk is likely get infected. Formula is likely when it is mixed. The anti-infective factor which is present in the human milk are not present in either animal milk or the formulated milk. Coming to the growth factors which are present, which I discussed, protein is correct and easily digestible. Fat is enough essential fatty acids, that is lipase, to digest. Iron, small amount, well absorbed. Vitamins, enough to the baby. And water is also enough, whereas animal milk and formulated is they require an extra. Whereas comparison of breast milk and cow in the formula composition, protein is more in cow's milk and compared to human, and which is not required. The ratio of whey and the casein ratio is 80-20 to 60-40, whereas whey and casein ratio in cow is 20/80, versus that is why it is not easily digestible. The difference between the human cow and the goat, the protein part, fat is more with the goat. Then coming to the protein part, the protein part is more in the cow, which is not required so much of protein, and the lactose is more in human milk. There is no need to add an additional sugar. Differences in the quality of the proteins in different milks. As I said, anti-infective proteins, whey proteins are present in human, that is 35% casein, whereas cow's milk it is 80% casein. Curdling is possible and it is difficult to digest. And human contains lot of fatty, essential fatty acids, enzyme lipase, and in cows there is no essential fatty acids. Coming to the vitamin C and vitamin A is rich in human, whereas cows it is more of B vitamin, less of vitamin C and vitamin A. Whereas coming to the iron, composition of iron is 50 in the human, whereas less, that is 10 and 90 absorbed and unabsorbed. The advantages of breastfeeding is it's a perfect nutrients to sum up, easily digested, efficiently used, protects against infection, helps bonding and development, helps in delay in a new pregnancy. Yes, it acts as a contraceptive. Absolute, that is lactational amenorrhea method, it gives absolute protection for 6 to 8 weeks. And later it has to be supplemented. Protects the mother's health. Cost is less than artificial feeding. The danger of artificial feeding would be the more diarrhea and respiratory infections, the persistent diarrhea, malnutrition, vitamin A deficiency, the more likely to die. Interferes with bonding, more allergy and milk intolerance, increased risk of chronic diseases, overweight, lower scores on intelligence tests. Breastfeeding, infant feeding health benefits. Scaling of breastfeeding could save the lives of more than 8,20,000 children under the age. There is a comparison with the maternal infant feeding, breast with the fed with the breastfeeding and the artificial. Definitely, there in the mortality there is a comparison. And associated with an IQ, there is an increase to 3 to 4 points. Children who are breastfed for longer periods have lower infections, morbidity, and mortality rates when compared to a breastfed for shorter periods who are not or who are not breastfed at all. The longer periods of breastfeeding are associated with a reduction in child's risk of overweight or obesity. Compared to the allergies, eczema, UTI, inflammatory bowel disease, diabetes type 1, gastroenteritis, Hodgkin's lymphoma, necrotizing enterocolitis. These are the benefits when compared to pneumonia, respiratory virus, sepsis, sudden SIDS, sudden infant death syndrome are very less compared to a breastfeeding kids compared to breastfeeding for shorter time or not at all breastfed. And it provides immunological protection while the infant's immune system is maturing. Antimicrobial agent, anti-inflammatory agents, immunomodulating agent. Breastfeeding could also prevent the death of 20,000 women a year from breast cancer. It is not only beneficial to the baby, it is beneficial to the mother. The incidence of breast cancer has come down. Breastfeeding could also improve the birth spacing. It acts, as I told prior, it acts as a spacing, not temporary contraceptive. Breastfeeding is associated with a reduction of women's risk of diabetes, and it might reduce the rates of ovarian cancer in the later date. Benefits to the family and to the society. Of course, the most important is the cost effective. It saves money, promotes family planning, decreases need for hospitalization, contributes to the child's survival. Whereas artificially fed, the maintenance cost itself is so high, and the risk of diarrhea because of the sterility, the way they're giving it. So artificial induced diarrhea is more, and the baby can die of artificial induced diarrhea rather than the other difficulties. Rules is exclusive breastfeeding for about 6 months. There should not be any top feeding. So exclusive EBF, exclusive breastfeeding, has to be given for 6 months and continue at least till the second year. Complementary foods rich in iron and other micronutrients should be introduced at about 6 months of age. Mother and infant should sleep in proximity to each other to facilitate breastfeeding. Earlier we used to call as rooming in, now it is called as bedding in, so that the temperature is also maintained of the baby. There is no need of warmer. When the baby sleeps next to the mother, the temperature is transferred from the mother to the baby, and that temperature is maintained. Initiation of the breastfeeding should be encouraged as soon as possible after the birth, ideally within 1 hour. Ensure 8 to 12 feedings every 24 hours till 2 to 3 months. Then 6 feedings till the 6 months. There should not be any hard and fast rule. So what we follow is the demand breastfeed. Whenever baby cries, mother has to feed. At every feeding, the infant is placed only on the one breast, as we told, hind milk and the fore milk and the hind milk, and then should be put on alternate. Should not be done for some time one and the other one. So you should be completely one breast, and next feeding should be on the other breast. The idea is fore milk and hind milk, and the baby will get satisfied. The duration of the feeding is about 20 to 30 minutes. However, it's said that there is no exact time. Every infant sucks the breast with a different frequency and a different duration of the feedings. So there is no hard and fast rule. The amount of milk that breasts produce depends partially on how much the baby suckles and how much of milk he removes. More suckling makes more milk. Breastfeed milk flow depends partly on the mother's thoughts, feelings, sensation. There should not be any supplements, and the pacifier should be offered while placing the infant in back to sleep position no earlier than 3 to 4 week age. and after breastfeeding, as we don't recommend in the Indian scenario. Indicators of good attachment and the positioning. Mouth should be wide open, less areola visible underneath the chin than the above the nipple. Chin touching the breast, lower lip rolled down and nose is free. And no pain. Mother should not get any pain. Indicators of successful breastfeeding in the babies. Breastfeeding babies 8 to 12 times a daily, audible and visible swallowing, sustained rhythmic suck, relaxed arms and hands, moist mouth, regular soaked or heavy nappies, about 6 to 8 wet diapers in a 24-hour. Average daily weight gain is 20 to 40 grams. Go to sleep and comfort after feeding. The indicators of successful breastfeeding in women is breast softening, there is no compression of the nipple at the end of the feed, woman feels relaxed and sleepy. All breastfeeding newborn infants should be given seen by a pediatrician at the age of 3 to 5 days of age. Hydration has to be evaluated, body weight has to be evaluated, and discuss the issues regarding the maternal and the infant, and observe the feeding and then certify it. All breastfed infants should receive 400 international units of vitamin D drops daily beginning during the first 2 months, but we don't generally recommend. Do not forget to give intramuscular vitamin K until after the first feeding is completed, but within the 6 hours of the birth. Positioning is very important. The proper positioning of the baby while breastfeeding includes supporting the whole baby's body, ensure the baby's head and neck or back are in the same plane. Entire baby's body should be face the mother. Baby's abdomen touches the mother's abdomen. The 4 signs of the good attachment are baby's mouth wide open, lower lip turned outward, baby's chin touches the mother's breast, and majority of areola inside the baby's mouth. Their breastfeeding position is a cradle position. That's the most common used by the mother. Then the other is football hold position, side lying position. This is probably a good position after a cesarean section, so that allows some new mother some rest. And cross cradle holding position, the Australian holding position. This probably pediatricians will go in detail and they'll explain what is the advantage of each position and that. And storage, coming to the storage, it can be stored at a room temperature for 6 to 8 hours. And expressed milk can be stored in an insulated cooler bag with an ice packs for 24 hours. And in a refrigerator for about 5 degrees, a refrigerator for 5 days at about 40 degrees Fahrenheit. It can be kept in a freezer up to 2 weeks, that is 0 to 5 degree Fahrenheit. It can be stored in a deep freezer for about 3 to 12 months. Barriers to breastfeeding, that is individual barrier, interpersonal barrier, institutional barrier, community barrier, and the policy makers. So that's why we have the policy, that is every hospital should have a policy about BFHI, breastfeeding hospital initiative. That is a written demand or a policy has to be written in the written and displayed in the every institute, and the breastfeeding has to be initiated within half an hour, and advantages disadvantages has to be briefed to the patient. And contraindications is infants having a galactosemia and phenylketonuria, and mothers infected with HIV. It's still a question mark, but in the developing country, yes, we do recommend, continue to recommend the breastfeeding, whereas in developed we don't, because they can give they can give a substitutes, but in Indian scenario, cost and the baby dying of diarrhea is more than with HIV. Breast In a developing country, we always recommend the breastfeeding. Never do the complementary and the breastfeeding combined. It will cause a more injury to the GIT of the baby, and baby getting contracting HIV is faster than giving it alone. Should avoid an alcohol. Breastfeeding mothers, occasional drink is acceptable, but breastfeeding should be avoided for 2 hours after the drink. But in Indian scenario, this is not a problem, hopefully. And commonly mistaken as contraindication are women received vaccination with live delivery, women who have cesarean delivery, who had a breast surgery, who had hepatitis A, hepatitis B, hepatitis C. So these are the commonly mistaken contraindications. And risks are iron deficiency, vitamin deficiency, but can be supplemented if it is a problem. Breast milk is ingeniously different every single day, adapted to the changing needs of the baby. Human milk for human baby. And last but not the least, I say the breastfeeding. A person who started with a bottle will always end with a bottle. And thank you.